This PSA is on racial disparities in maternal mortality. The United States spends more on maternity care than any other country in the world, yet it has the highest rates of infant and maternal mortality than any other industrialized country. The number of maternal deaths rose from 396 in 2000 to 856 in 2014. Infant mortality rates are twice, and maternal mortality rates are 3 to 4 times higher in Black versus white women. It was also found that the risk of maternal death is 2 times higher in high poverty areas compared to low poverty areas. Maternal mortality is any death that occurs anytime during a woman's pregnancy. It can be during labor and delivery and up to 1 year during the postpartum period. The leading causes of maternal death, according to the CDC from 2011 to 2015, were heart disease and stroke, obstetric emergencies, and cardiomyopathy. So why are we seeing increased rates of death in minority women during pregnancy? One factor is genetics. African American women have higher incidences of hypertension, stroke, and diabetes. Another factor is increased exposure to stress, and a third is disadvantaged living environments with lack of access to health care. So what are some solutions for change? One change that took place in 2018 was the Improving Access to Maternity Care Act. It was passed, and ACOG made a response to this bill by stating it responds to our nation's growing maternity care shortage by ensuring that the National Health Service Corps sends OBGYNs to areas of greatest need, bringing essential care to pregnant women regardless of where they live. So how can we make a difference as advanced practice nurses? For one, we can focus on modifiable risk factors. We can educate on the importance of healthy living, diet, and exercise. We need to educate on the importance of family planning, taking prenatal vitamins prior to conception and throughout pregnancy, and notify these women of their higher risk for complications during pregnancy. They need to know what the warning signs are and when they should be seeking immediate care. Also, we need to recognize and treat hypertension and diabetes in pregnancy and follow evidence-based guidelines during treatment. Finally, we can provide support to these patients. Just listen and act upon any concerns that the patient may voice. Ensure that we're eliminating any implicit bias, and provide simple things like travel vouchers for those who may have trouble getting to and from appointments. And also, we should be providing information on local pregnancy support groups, which can be helpful. The Council on Patient Safety and Women's Healthcare has a set of recommendations called the Patient Safety Bundle. It provides practitioners and healthcare systems with guidance on how to reduce racial disparities in the peripartum care. One recommendation is to have a system in place to document race, ethnicity, language, and demographic information. They also advise educating all staff on racial and ethnic disparities and their root causes, as well as implicit bias. Third, they recommend to monitor process and outcome metrics stratified by race and ethnicity. And finally, when reviewing cases with adverse outcomes or mortality, ask, did race, ethnicity, language barrier, or specific social determinants of health contribute to the morbidity? And if so, are there system changes that could be implemented that could alter the outcome? Together, we can make a change. We can see a decrease in the maternal death rates among minority women by supporting legislation that promotes increased access to care, health care for all communities, by educating these women on the importance of family planning, prenatal care, keeping appointments, and just that they're aware of their increased risk during pregnancy. And finally, we need to educate our coworkers and our staff members on health inequality and racial disparities so that they can be aware and can make changes as well. Thank you.